Hi, I'm Dr. Athre with Athre Facial Plastics in Houston, Texas. This video is created for patients to have an idea of what happens during a facelift surgery. The first portion of the facelift is simply incisions that are marked so that we know where all the incisions and skin incisions are going to be. Following that, the entire tissues of the face and neck are anesthetized with local anesthesia. Please note that the patient has already been sedated prior to this, and major nerve blocks have already been performed. You can look at the patient's facial expressions and see that the patient is relatively quite comfortable during this entire process. The surgery itself starts with the submental incision. This is an incision that is made just below the chin. Once the incision is made, facelift scissors are used to dissect the skin from the underlying tissues. The plane of this dissection is subcutaneous. A small amount of liposuction is performed in order to further enhance the tissues and visualization of the tissues. Once this is done, the rest of the facelift incisions on each side of the face are performed. These incisions are extremely precise and made with a sharp number 15 blade scalpel. Once the incisions have been made, dissection is performed in order to elevate the skin from the underlying tissues. The plane of dissection here is subcutaneous. Due to the injection of these tissues with local anesthesia, most of the small blood vessels do not bleed due to the addition of epinephrine in the local anesthetic mixture. Behind the ear, the dissection is performed in a subcutaneous level and connected to the dissection that was performed in the neck. Once the dissection is done, several small bleeders are addressed using bipolar electrocautery. Now, the SMAS or muscle layer is subsequently marked. Various anatomical structures are marked on the SMAS layer. The SMAS layer is injected with saline in order to hydrodissect it and help elevation of this muscle layer off of the underlying tissues. The SMAS muscle layer is subsequently elevated from its underlying tissues. This is a very careful and meticulous dissection, and a significant portion of this dissection is performed simply by spreading. The dissection in the lateral portion of the neck is performed beneath the platysma muscle. Once the dissection is performed, the muscle layer is grasped and retracted in a posterior-superior direction. Excess muscle is trimmed in order to prevent bunching. A good dissection of these tissues will allow the tissues to be redraped posteriorly with very little tension. Please notice the very small gauge of the suture because these tissues are not under tension. The same is performed in the midface, and the same is performed in the lateral neck. One can clearly see the amount of excess skin following the facelift. Following the lift, Tisseel is sprayed in the wound bed to minimize bleeding. I named this procedure delivery of the baby, which is delivery of the ear lobule. This is a very important part of the closure of a facelift to minimize any deformities with the ear lobule. This closure is completely tension-free. The excess skin is carefully marked and subsequently resected. Once the excess skin has been resected, the incisions are carefully closed using meticulous suturing techniques. Following this, attention is subsequently turned to the neck. A midline platysmoplasty is performed to tighten the neck as well as further define the neck angle. Here, excess skin in the posterior and lateral aspect of the neck is addressed and resected. This video was created to give the viewer a basic idea of what happens in a facelift, not describe every single technique. I hope this has been useful. If you have any questions, please do not hesitate to reach out to us via our website or any of our social platforms. Thank you.